Dear participants, welcome to the second of the medical webinar series presented to you by the Global Healthcare Travel Council and the Near East University. This webinar is broadcasted live on the official YouTube channel and it will be broadcasted for future use. My name is MUSTAFA and I will be moderating this session. In today's webinar, our speaker is Professor Dr. HÜSEYİN GÖKÇEKUŞ, the Dean of the Faculty of Civil and Environmental Engineering from the Near East University. He will be delivering his presentation to us about the topic climate change and its impact on the healthcare travel boom. Now, I would like to invite Professor Dr. HÜSEYİN GÖKÇEKUŞ to the screen. Professor?
Yes. Good afternoon. Hello, everybody. I would like to say welcome you all to our presentation. As moderator said, my presentation topic is climate change and its impact on healthcare travel boom. This is my content. Introduction, climate change and its impact on healthcare travel. I'm planning to make a simple introduction. Later on, factors driving healthcare travel, climate and health, sustainable healthcare travel, best practices for reducing environmental impact, role of governments and private sectors, policy initiative and investment. And finally, recommendations and future trends, strategies for sustainability and adaptation. Let's start with introduction. Climate change is increasingly affecting global health, contributing to the healthcare travel boom as patients seek specialized treatments abroad. Rising temperatures, extreme weather, and shifting disease patterns strain healthcare systems, promoting medical tourism for better or quicker care. This trend underscores the urgent need for robust, climate-resilient healthcare infrastructure to mitigate these challenges and ensure global health security. Understanding climate change. Understanding climate change involves recognizing long-term shifts in temperature, weather patterns, and sea levels primarily due to human activities like burning fossil fuels. This global phenomenon leads to more frequent extreme weather events, rising sea levels, and altered ecosystems, affecting biodiversity and human life. Addressing climate change requires urgent action to reduce greenhouse gas emissions and transition to sustainable practices. Global temperature rise, impact on health. Global temperature rise significantly impacts health, leading to increased heat-related illness, respiratory issues, and the spread of vector-borne disease like malaria and dengue. Higher temperatures exacerbate chronic conditions, strain healthcare systems, and disproportionately affect vulnerable populations, such as the elderly and children. Addressing these health challenges requires adaptive measures and a concerned effort to mitigate climate change's effects on public health. Extreme weather events, consequences for healthcare. Extreme weather events intensified by climate change have severe consequences for healthcare. Hurricanes, floods, and wildfires disrupt healthcare services, damage infrastructure, and limit access to care. These events increase injury rates, cause waterborne disease, and strain emergency services. Healthcare systems must adapt to ensure resilience, preparedness, and continuity of care during and after such disasters to protect public health. Air quality deterioration, respiratory health impact. Air quality deterioration driven by pollution and climate change severely impacts respiratory health. Increased levels of pollutants like particulate matter and ozone exacerbate asthma, bronchitis, and other lung disease. Long-term exposure can reduce lung function and increase mortality rates from respiratory and cardiovascular conditions. Protecting air quality is crucial to safeguarding public health and preventing the escalation of respiratory illness. Water scarcity effects on hygiene and healthcare. Water scarcity significantly affects hygiene and healthcare, limiting access to clean water for drinking, sanitation, and medical use. This leads to poor hygiene practices, increased spread of waterborne disease like cholera, and compromise healthcare services due to insufficient water for cleaning and medical procedures. Addressing water scarcity is crucial to maintaining public health, preventing disease outbreaks, and ensuring the effective operation of healthcare system. Food security. Let's talk about the food security, malnutrition, and health implications. Food security is vital for health, yet climate change treatments it by affecting crop yields and food distribution. These can lead to malnutrition, especially in vulnerable populations, resulting in stunted growth, weakened immune systems, and increased susceptibility to disease. Addressing food security is crucial to preventing malnutrition and its long-term health implication, ensuring everyone has access to sufficient, safe, and nutritious food. Heat waves and health, direct health impacts. Heat waves pose significant direct health risks, including heat exhaustion, heat stroke, dehydration, and cardiovascular strain. Prolonged exposure to extreme heat can worsen pre-existing conditions such as respiratory and heart disease. Vulnerable groups like the elderly and children are especially at risk. Adaptation strategies, including cooling systems and heat action plans, are essential to mitigate these health impacts and protect affected populations. Let's talk about the vector-borne disease spread due to climate change. Climate change is expanding the range of vector-borne disease like malaria, dengue, and Zika virus. Warmer temperatures and altered rainfall patterns create favorable conditions for mosquitoes and other vectors to thrive in new areas. This increased spread puts more population at risk, challenging healthcare systems. Preventing measures and adaptation strategies are crucial to control these diseases amid a changing climate. Healthcare infrastructure strain, increased demand. Healthcare infrastructure faces significant strain due to increased demand for climate change-related health issues. Extreme weather events, rising disease, and climate-induced stress on vulnerability populations require more resources and personnel. Overburdened systems struggle to provide timely care, risking poorer health outcomes. Strengthening healthcare infrastructure and enhancing preparedness are essential to ensure resilience and meet the growing healthcare needs in the face of climate change. Migration and displacement, healthcare challenges. Migration and displacement, often driven by climate change, create significant healthcare challenges. Displaced populations face inadequate access to medical services, malnutrition, and higher risk of infectious disease. Overcrowded conditions and limited resources strain healthcare system in receiving areas. Addressing these challenges requires coordinated international efforts, improving healthcare infrastructure, and providing targeted services to support the health needs of displaced communities. Healthcare travel boom, defining the trend. The healthcare travel boom refers to the increasing trend of patients seeking medical treatments abroad, driven by factors like climate change, rising healthcare costs, and access to specialized care. Patients often travel for quicker, more affordable treatments or to avoid local healthcare system strains. This growing phenomenon highlights the need for adaptable healthcare infrastructures and improved international medical cooperation. Factors driving healthcare travel, climate and health. Climate change and health-related factors are key drivers of healthcare travel. Extreme weather events, rising disease burdens, and strained local healthcare systems prompt individuals to seek care abroad. Patients may look for specialized treatments, quicker access, or better healthcare infrastructure, often in regions less affected by climate-related health challenges. These trends underscore the need for global healthcare collaboration and adaptability. Medical tourism destinations, popular regions. Popular medical tourism destinations include countries like Thailand, India, Mexico, and Singapore, offering high-quality care at lower costs than in developed nations. These regions attract patients seeking affordable treatments, specialized surgeries, or wellness care. Many destinations are renowned for advanced healthcare infrastructure experienced medical professionals, and the focus on patient comfort, making them attractive for international medical travelers. Climate as push factor. Why people travel for healthcare? Climate change acts as push factor in healthcare travel, as extreme weather events and rising health risks make local healthcare systems less reliable. Patients may seek treatments in regions less affected by climate-related stressors or select destination with specialized care for climate-induced health conditions. Travel becomes a way to access better care amidst local health system strains caused by climate change. Healthcare system resilience, adapting to climate change. Healthcare system resilience is essential to adapt to climate change impacts. This includes strengthening infrastructure, improving emergency response capabilities, and addressing climate-related health risks like heat waves and disease outbreaks. Building capacity for disaster preparedness, ensuring equitable access to care, and incorporating climate conditions into health policies can help systems withstand climate shocks and continue to provide essential services during challenging times. Technological innovations in healthcare and travel. Technological innovations in healthcare and travel have revolutionized patient care and medical tourism. Telemedicine allows remote consultations, while advanced diagnostic tools improve treatment accuracy. In healthcare travel, digital platforms streamline booking, and artificial intelligence enhances personalized treatment plans. These technologies enable patients to access high-quality care abroad, reduce costs, and increase efficiency, transforming the medical tourism landscape for a global audience. Economic impacts, healthcare travel, and local economies. Healthcare travel has significant economic impacts on local economies, especially in popular medical tourism destinations. It generates revenue through medical services, accommodation, and tourism-related activities. Additionally, it creates jobs in healthcare, hospitality, and transportation sectors. However, it also raises concerns about accessibility for locals, as increased demand for services may strain resources and affect the affordability of healthcare. Environmental impact of travel, carbon footprint concerns. The environmental impact of healthcare travel is significant primarily due to the carbon footprint of transportation. Air travel, often essential for medical tourism, contributes to greenhouse gas emissions, exacerbating climate change. As demand for healthcare travel increases, sustainable practices such as using greener transport options and promoting local care solutions are crucial to reduce environmental harm while ensuring healthcare access. Policies and regulations governing healthcare travel. Policies and regulations governing healthcare travel aim to ensure patient safety, quality of care, and ethical standards. These include regulations on medical qualifications, treatment standards, and cross-border healthcare agreements. Countries may establish guidelines for accreditation of healthcare providers as well as consumer protection law. Effective regulations helps maintain the integrity of the healthcare travel industry while protecting both patients and providers. Sustainable healthcare travel, best practices. Sustainable healthcare travel focuses on minimizing environmental impact while ensuring patient care. Best practices include promoting local healthcare options using eco-friendly transportation and encouraging telemedicine for follow-up consultations. Destinations can invest in green healthcare infrastructure and reduce waste in medical facilities. Additionally, collaborating with patients to choose sustainable travel methods and accommodations can further reduce the overall environmental footprint of medical tourism. Case studies, real-world examples. Let's give real-world examples as a case study. Case studies of healthcare travel illustrate diverse real-world examples of the trend. For instance, Thailand and India are renowned for offering affordable, high-quality medical treatments, attracting patients worldwide. In Mexico, patients seek dental care and surgeries drawn by cost-effective services. These case studies highlight how various regions leverage healthcare tourism to boost local economies and enhance access to specialized care. Public awareness and education. Role in mitigating impacts. Public awareness and education play a crucial role in mitigating the impacts of healthcare travel. By informing patients about climate-related health risks, the importance of sustainable travel, and available local healthcare options. Awareness campaigns can promote responsible medical tourism. Educating both healthcare providers and travelers ensures informed decision-making, reducing the strain on healthcare systems and minimizing the environmental impact of medical travel. Role of governments, policy initiatives. Governments play a key role in addressing climate change's impact on healthcare travel through policy initiatives. This includes implementing strategies to strengthen healthcare systems, improve climate resilience, and regulate medical tourism. Policies may also promote sustainable travel, support international healthcare collaborations, and ensure the climate-related health risks are integrated into public health planning, safeguarding both local and global health systems. Private sector involvement, partnerships, and investments. The private sector's involvement is crucial in addressing the impact of climate change on healthcare travel. Partnerships between healthcare providers, travel agencies, and technological companies can improve patient access to climate-resilient healthcare. Investments in sustainable medical tourism, infrastructure, green technologies, and innovative solutions like telemedicine can help mitigate environmental impacts while enhancing the global healthcare travel experience in the face of climate challenges. Future trends, predictions for healthcare travel. Future trends in healthcare travel are shaped by climate change, technological advancement, and shifting patient demands. Increased demand for sustainable and climate-resilient healthcare options will drive growth in medical tourism, telemedicine, and artificial intelligence-driven diagnostic will make remote care more accessible. Additionally, regions with advanced healthcare infrastructure and eco-friendly practices will become increasingly popular as patients seek cost-effective, high-quality treatments. Challenges and opportunities addressing climate impact. Addressing climate impacts on healthcare travel presents both challenges and opportunities. Strained healthcare system increase demand for care, and environmental concerns pose significant challenges. However, these issues also create opportunities for innovation, such as sustainable healthcare solutions, improved medical infrastructure, and digital health technologies. By fostering collaboration between governments, private sectors, and healthcare providers, we can mitigate risks and enhance patient care. Recommendations, strategies for sustainability. To promote sustainability in healthcare travel aimed climate change, strategies should include encouraging local healthcare options, adopting green healthcare practices, and investing in eco-friendly travel solutions. Governments and private sectors can collaborate to develop climate-resilient healthcare infrastructure, while telemedicine can reduce travel-related emissions. Additionally, raising awareness about sustainable medical tourism and promoting responsible practices will help mitigate climate impacts. Now, I reach to my last part of presentation. This is my conclusion. In conclusion, climate change significantly impacts healthcare travel, presenting both challenges and opportunities. Strengthening healthcare systems, promoting sustainable travel, and fostering international collaboration are essential for mitigating these effects. By adopting innovative solutions like telemedicine, investing in resilient infrastructure, and raising awareness, we can ensure that healthcare travel boom remains accessible, sustainable, and equitable while safeguarding public health in a changing climate. Thank you so much for your attention, and please don't hesitate to ask any question. If you have any questions, anytime, you are welcome. Thank you so much again.
Thank you very much, Professor, for sharing your valuable insights about the topic. I'm sure our audience enjoyed and benefited from the information you have provided. I would like to end this session by thanking to Professor Dr. HÜSEYİN GÖKÇEKUŞ for his contributions. Professor, it was lovely to be here with you today. Thank you very much for your valuable contributions to our medical webinar series. Also, many thanks to participants today. We wish to meet you in the upcoming events, and until then, I wish you good and healthy days.
Hayat hızla akıyor ve biz bu hızı seviyoruz. Her güne heyecanla başlıyor, her anı doya doya yaşıyoruz. İlk günkü heyecanımızla yılları aşıyoruz. Zaman akarken biz de kendimizi arıyoruz. Heyecanla, merakla. Sen de kendini mi arıyorsun? O zaman zamana yetiş. Bu sadece kendini bulmakla ilgili değil. Asıl heyecan kendini yaratmakta. Bir şeyler mi yaratmak istiyorsun? Mükemmel. Metali işlemeyi, bir bina yapmayı, bir iş kurmayı, hatta bir şehir kurmayı öğren. Hayat kurtarmak, teknoloji geliştirmek, üretmek. Hepsi burada. Ve burada tüm deneyimler profesyonellerle yan yana. Ancak hızlı ilerlemeliyiz. Çünkü bugün şimdi gerçekleşiyor ve yarın çok yakın. Hayatta öne geçmek istiyorsan önce zamanın önüne geçeceksin. Hep ileri gideceksin. Bu Doktor Suat İrfan Günsel. Tanıyor musun? Onun da söylediği gibi üniversiteler toplumların dokuma tezgahıdır. Toplumları geliştirir, dönüştürür ve gelişmesini sağlar. O burayı bugünden yarına hazırlamak için kurdu. Senin için, ileriye gitmek için. Yana ya da geriye değil. Sadece ileri. Çünkü gelecek çok yakın. Hadi harekete geç. Fikirlerin ne kadar ileride olursa yarına o kadar yaklaşırsın. Yanındakileri de geleceğe taşırsın. Bu senin geleceğin, senin fırsatın şimdi. Hadi yarın yakın. Hepimizi ileriye götür.